Hi everyone, it's Dr. Libby and today we are talking teeth. What a surprise. Now, I'm a specialist pediatric dentist and I get a really thorough examination of my patients, and one of the things that I always record is how the gums are looking, because gums are a reflection on your oral health. Lots of people are surprised when a dentist can tell if they have been brushing well all the time or if they just panicked before they came in to see them and did a quick good brush. And I'm going to tell you how. This is a dental kit, which I use for all my patients. It is sterilized and packed after being thoroughly cleaned. Inside the kit, what is important for me is the mirror, so I can look around people's teeth, and I say that I use the mirror so that I don't have to put my whole head in your mouth, which is quite a good deal. The second thing, which is really important to me, is this. This is a probe. So a probe is something that we use to feel things. And this one has a very, very round, small ball on the end, and that makes it very safe. So I could do this repeatedly. It's not going to hurt me because it's a small round ball and it's blunt, it's not sharp. It's just very, very small. The purpose of this probe is to feel things. It can help me to feel if something is smooth or if something is bumpy. It can help me to feel if something is hard or if something is soft. That is by using tactile sensation, which is something really important to dentists. The only other way for you to know how things are feeling are to run your tongue over them. And obviously I can't do that on your teeth. So we're going to use a probe. Probes are very useful at telling dentists if you've been brushing well. How? Because when you have been brushing well, your gums will be very, very strong. And that means if somebody touches them, they will not bleed. If you have not been brushing well, your gums will be very, very thin and fragile. And as soon as anything touches them, even if it's blunt and it isn't going to damage anything, it will make them bleed. And that's why when we run our probe like this around your gums, it tells us two things. First, we can see if there's any plaque on the probe. And second, we can see if your gums stay pink and strong or if they bleed. If your gums are bleeding, it's a sign from your body telling you you need to keep that area more clean. And that is how a dentist knows. A dentist knows because when they touch your gums, if they do not bleed, it means you have been brushing well for a very long time. If they touch your gums and they bleed, it means that you have not been brushing very well. And if they find any plaque there, it means there's plaque buildup. But remember, just because there's no plaque there and you've done a really, really good job of brushing that day before you come into the dentist is still gonna know. We're still gonna know whether or not you've been brushing well. So keep up your brushing in between your appointments. If you need more motivation, just watch my videos. Grab yourself a nice toothpaste from HiSmile, get a new toothbrush to motivate yourself, whatever it takes to keep you on track and keep your gums nice and healthy like mine.